I'm Dr. Shabani, course leader of Head and Neck course, and I hope you are fine. And I talk about some point before the class about the theoretical classes will be held online, and I record the file. After the class, I send the recorded file link for representative, and about the practical classes. They will be held after New Year in better condition. Okay, if you have a question, you can type a question in public chat, or you can activate microphone and ask your question. The first session is about skull bones, and in this session I explain about frontal bone, occipital bone, parietal bone, and sphenoid bone. As you know, the bones of human skeleton are divided two main groups, axial groups and appendicular skeleton. Actually, appendicular skeleton consists of lower limb bones and upper limb bones. And axial skeleton include the skull, sternum, ribs, and vertebral column. The skull is linked to appendicular skeleton and contains 22 bones. In anatomy, we categorize the skull to calvaria or brain box bones and facial skeleton bones. Actually, facial skeleton bones form the face and forms the face bones. Calvaria or brain box bones are near 8 bone, and facial skeleton bones are near 14 bones. Mandible bone is a single bone located in the face, and it's just a mobile bone in the facial skeleton. Actually, cranium is a skull without the mandible bone. So I explained about the calvaria or brain box bones. Calvaria bones or brain box cover and protect the brain and nervous system, and contain of 8 bones, 1 frontal bone, 1 occipital bone, 2 parietal bones, 2 temporal bones, and 1 ethmoidal bones, and 1 sphenoid bone. This is the frontal bone, occipital bone, 2 parietal bone. The green bone is the temporal bone, and this is the ethmoid bone, and this is the sphenoid bone. And facial skeleton contains 14 bones, include the 2 maxillary bone, 2 zygomatic bone, 2 nasal bones, and 2 lacrimal bones, and palatine bone is located posterior to maxillary bone, and finally two inferior nasal conchae bone. And finally, you can see one mandible bone and one vomer bone. This is the blue bone, is a vomer attached to ethmoidal bone. As you know, you can see a frontal bone and two parietal bone. There is a suture between frontal bone and parietal bone. It's called coronal suture or frontal suture. You can see hemipart of coronal suture in this picture. And there is a sagittal suture between two parietal bone and one occipital. There is a sagittal suture between two parietal bone, and another suture is a lambdoid suture. Actually, lambdoid suture is located between two parietal bones and occipital bone. This is a lambdoid suture. In this slide, you can see junction of suture. The junction of suture of coronal and sagittal suture is bregma, and the junction of sagittal suture and lambdoid suture is the lambda. So you should know about the bregma and lambda. This location in embryological duration and even after the birth, this location are also soft tissue even after the birth. And so finally, this location must be closed within 1 year of birth. This is location of bregma, and this is location of lambda. Oh, sorry, just a bit. Okay, sorry guys. This location, bregma and lambda, are also soft tissue after even after the birth, and they must be closed within 1 year of the birth. At first, I explained about frontal bone. You know, frontal bone forms the forehead, and is a blue bone in picture. Actually, the frontal bone consists of vertical part and horizontal part. Horizontal part forms the roof of orbital cavity. So this part is called orbital part or orbital plate. Actually, the vertical part of frontal bone has two surfaces: external surface or anterior surface, and internal surface or posterior surface. External surface in the vertical part, You can see a supraorbital margin. This is a supraorbital margin. Supraorbital margin is started from nasal notch. This is the nasal notch, and terminate to zygomatic process. This is the zygomatic process. There is a notch or foramen as a supraorbital notch or supraorbital foramen. It's located between 1/3 medial and 2/3 lateral of supraorbital margin. Actually, the supraorbital foramen or notch is for passing supraorbital nerve and vessels. Superior to supraorbital margin, you can see eminence. This eminence is called superciliary arch. This is the superciliary arch. Inside the superciliary arch is a frontal sinus, frontal air sinus. Do you know about frontal air sinus? Who is explain about air sinus in a skull? What is the air chamber or air sinus in a skull, and what's the function? Okay, I explained that actually from air sinus to produce mucuses. Yes, thank you, Lubna. Can you explain more? Actually, air sinus or frontal air sinus is a chamber. It's located inside the superciliary arch and contain of mucosa, and mucosa leading to moistening the breathe. When we breathe, it's leading to moistening the air. And thank you. That's right. And there is a depression area between the superciliary arch, this location, and this is the glabella. It's called glabella. Superior to superciliary arch, you can see eminence or eminence or frontal tuber. This is a frontal tuber, is more prominent in men. And finally, you can see after the zygomatic process, behind the zygomatic process, there is a line, is called temporal line. Actually, temporal line is drawn from zygomatic process to behind the vertical part of frontal bone. And there is a fossa inferior to temporal line as a temporal fossa or temporal surface. There is a suture between frontal bone, nasal bone, and maxillary bone. The name of suture is frontonasal suture, and at the midpoint of this suture is called nasium. It's very important. The midpoint of frontonasal suture is called nasium. You can see internal surface of vertical part. In the vertical part, you can see a groove or sulcus for superior sagittal sinus. This is the sinus inside, is located inside the dura mater, and this is groove for this sinus. Finally, the groove terminate to frontal crest. This is the frontal crest for attaching cerebral falx. Cerebral falx is a part of dura mater, and inferior to frontal crest there is a foramen. This foramen is called from foramen cecum. Foramen cecum for passing emissary vein. This is the superior sagittal sinus, and it's located inside this groove in the frontal bone, and you can see foramen cecum between the frontal bone and ethmoidal bone. In this slide, you can see a horizontal plate or orbital part of frontal bone. There is a U-shaped notch or U-shaped structure between the orbital plate. The name of U-shaped structure is ethmoidal notch, because ethmoidal bone is located inside the notch. In previous slide, you can see ethmoidal bone is located between orbital plate of frontal. And at the corner of orbital plate, there is a fossa. It's here. Fossa is for location of lacrimal gland. Lacrimal gland is located is here and produce secretion, and the secretion is finally safe to lacrimal sac. Another bone is a parietal bone. There are two parietal bones. There is a sagittal suture between left and right parietal bone, and the parietal bone is a quadrangular shape, and it has a superior margin or superior border, inferior margin, anterior margin, and posterior margin. In previous slide, you can see superior margin attached to frontal bone and forms the coronal suture. Posterior margin attached to occipital bone and produce lambdoid suture, and this is the anterior border, this is the posterior border. And the superior border of parietal bone connected to another superior border of parietal bone and forms the sagittal suture. And finally, inferior border or squamosal border connected to temporal bone. This is the squamosal or inferior margin. On the lateral surface or external surface, there is an eminence. It's called parietal tuber or parietal eminence. And there are two lines, superior temporal line and inferior temporal line. Superior temporal line is not very clear on the parietal bone. but this inferior temporal line is visible and is very clear on the bone. Actually, temporal line on the frontal bone is divided to superior and inferior temporal line on the parietal bone. And you know about the brecma and lambda. Brecma is junction for coronal suture and sagittal suture, and lambda is a junction for lambdoid suture and sagittal suture. And finally, on the lateral surface of parietal bone, there is a foramen, parietal foramen for emissary vein. This is the parietal foramen for passing the emissary vein. In this slide, you can see internal surface of parietal bone. In the internal surface, there are many arterial sulci. This is the sulci for branch of middle meningeal artery, and this is the branch of middle meningeal artery, and there are more foveolar as a granular foveolar for arachnoid granulation. It's location for arachnoid granulation. And finally, in the internal surface, there is a continuous groove for superior sagittal sinus in this bone. This is the external surface, and this is the internal surface of parietal bone. In the lateral side of the skull, you can see a H structure. The H structure is petrion, and petrion is junction of four bones: frontal, parietal, temporal, and sphenoid bones. This is the junction of four bones, and it's very, very important in clinical because inner to H point or petrion, the middle meningeal artery passing, and so during the injury, its location, this location maybe is damaged and leading to injury to middle meningeal artery. The classes started near 1 o'clock, and it's the first session, yes. So all of the students enter the class with headset. Please exit the class and enter to class again with microphone, because during the class I maybe ask your question and you should answer the question. Thank you. Yes, Shafei, please ask the question. I wait for question. Shafi, I think your raise hand. Okay. Another bone is occipital bone. Occipital bone forms behind the head, and it includes the three parts. The squamous part is here, basilar part is a quadrangular shape, and this area is lateral part. And there is a large foramen between this part. The name of foramen is foramen magnum for passing spinal cord and the vertebral artery. This is the occipital bone, and you can see a squamous part, foramen magnum, and lateral part, and this is a basilar part. The squamous part has a lateral surface and internal surface. This is the lateral surface, and you can see a prominence or tuber on the occipital bone is called external occipital protuberance. And from the protuberance, you can see a crest started from eminence to foramen magnum. The name of crest is external occipital crest. This is the external occipital crest. If it's the external occipital crest, near the initiating point, you can see a superior nuchal line is drawn to lateral part, and superior to superior nuchal line, there are another line called highest nuchal line. This is the highest nuchal line. And there is another line as an inferior nuchal line. It's located midpoint of external occipital crest. If it's external occipital protuberance, the central point of the prominence is inion. Actually, inion is the central point or prominent point of external occipital protuberance. This is the internal occipital protuberance, and in the medial surface or internal surface, you can see internal occipital protuberance according to external occipital protuberance here, and there is an internal occipital crest started from prominence to foramen magnum. This is the internal occipital crest. So lateral to internal occipital protuberance, there is a groove for transverse sinus. This is the groove for transverse sinus, and superior to internal occipital protuberance, there is the